Good morning. My name is Joyce Nedziwe. Today I'm presenting on root cause analysis, or RCA, as a key tool for continuous quality improvement in healthcare, with a focus on enhancing patient safety. This presentation will describe the tool, explore its applications, provide a critical analysis of its advantages and disadvantages, and evaluate its overall effectiveness. I'll also draw on recent evidence to support my points. RCA facilitates a comprehensive examination of events, enabling organizations or healthcare sectors to identify the fundamental causes of disruptions or inefficiencies. It aims to identify the root cause, such as system flaws, human errors, or process gaps, rather than addressing a surface level um, symptoms. The process involves assembling a multidisciplinary team, gathering data through interviews and records, mapping the event timeline, and using tools such as the fishbone diagrams or the 5 whys technique to drill down the fundamental issues. So this tool is evidence-based in that Kube in his 2025 analysis reports that it is a holistic approach to what contributed to the issue, understanding the systems, and implementing corrective actions to prevent recurrence of adverse events in future for continuous quality improvement. It's also supported by Allison and Peters in their 2021 research, who identifies that RCA is a systematic investigative approach which lays a good foundation for policy and systems reform to reduce and prevent avoidable adverse events, as well as Albayati and others in 2021 highlights that it has been commonly utilized in healthcare systems to identify the potential causes of medical errors to develop improvement strategies for the quality of care. RCA's key principles are that it is a systematic approach in that it examines events considering the entire system rather than focusing on the isolated incident or an individual's performance. It's holistic in nature in that it's a comprehensive exploration of various contributing factors, including processes, systems, human elements, and external factors to influence and identify the primary cause of an issue. It's a data driven analysis. It collects and analyzes data such as interviews, observations, document reviews, and case studies to ensure that conclusions are grounded in solid evidence, leading to more effective and credible solutions. And it is also multidisciplinary. Um, it includes multidisciplinary teams to gain a holistic understanding of the factors influencing the issue without bias or impartiality. It focuses on solving problem solving by addressing the root cause rather than treating the system, fostering a proactive approach to continuous improvement. And it involves revisiting and refining the analysis as new information becomes available, ensuring a thorough understanding of the issue. RCA uses various tools such as the 5 whys, um, which is a structured and effective investigation tool into the root causes to ensure that all aspects of the issues are addressed. It contributes to a culture of continuous improvement by identifying fundamental causes of problems, promoting a learning environment within the organization. The major steps in RCA includes identifying an incident, mapping a timeline, and then analyzing the critical events, the cause and effect chart, then identifying the root causes of that incident with evidence, and then addressing or finding ways to best address the problem, developing recommendations, and then presenting a report when required to stakeholders. I'll also discuss a scenario which occurred in my organization, which is the mental health unit. A patient came in with suicidal ideation and was admitted in the hospital. This patient was then discharged 3 days after due to bed pressures and slight resolution of the suicidal ideation. However, this patient succeeded or attempted suicide and succeeded 48 hours post discharge. So, an RCA investigation was implemented with the five whys approach as the tool. So, the five whys included questions such as why was the patient discharged early? Why did the why was there need for beds or why was there bed pressure? Why was why was occupancy so high in the mental health unit? And why were discharges delayed? Why were there no community follow-ups available to support this patient in question? Root cause analysis in this scenario identified that the patient's demise was not just a clinical error or clinical decision error, it was a systematic failure in that there were bed shortages in the hospital. There was lack of community support or resources in region of Victoria to adequately support um, this patient after discharge. And there was also a gap in discharge planning. So, recommendations resulted from this root cause analysis, which included developing step down facilities such as the PAC, which is the Prevention and Recovery Center, recommended by the Department of Health. There was also a recommendation for strengthening links with the housing department to ensure that these patients discharged from mental health unit have adequate housing supports. And there was also need or a recommendation to improve discharge planning pathways. All these recommendations were identified following the thorough assessment or analysis done by the root cause analysis tool, which was implemented to improve quality and discharges within the mental health department. Advantages of root cause analysis are that it's like a preventative medicine for adverse events. It zooms on the true nature of problems into focus and identifies root issues and acting as a safeguard against future troubles, saving precious time and resources while boosting overall performance. It also centers on informed decisions by providing a clear understanding of the underlying issues, reducing guesswork, and increasing the likelihood of success. Um, it's also not just about fixing problems, it's about learning from them. It nurtures a culture of curiosity and continuous improvement within organizations. And in so doing, um, it complies with the national standards for health and safety in Australia. And these compliance and regulations enhances quality assessments within the healthcare sectors. This too comes with its own disadvantages in that it is time and resource intense. It is also quite complex and subjective in that different multiple stakeholders come with different interpretations of events, which could become an issue if not properly managed. There is also potential for blaming culture if it's not adequately implemented. So there's need for proper training to utilize the root cause analysis. Um, and there is also some implementation challenges in that in some situations, such as in mental health, it can be quite challenging to to utilize the root cause analysis in adverse events. So there needs to for proper structure and proper planning to for utilize this tool, which can significantly impact on the outcome, as well as resources available to adequately utilize this tool. However, regarding patient safety, RCA is quite unique in that it reduces clinical and surgical errors in adverse events, complying with national standards, its particular Standard 5, through safer care planning. It increases medical error prevention in various specialties, as highlighted by Singh and others in their research, thereby establishing a quality improvement framework. It also strengthens risk management and thereby complying with national standards, Standard 1, which addresses systematic risk management or risk assessments. Root cause analysis has proven to be an effective method of quality improvement in safety in patients, as highlighted by Martin Delgado and others in their 2020 report. The multidisciplinary investigations have proved to be quite thorough, where they've been addressed, and its success depends on organizational commitment and resource availability. Therefore, ultimately, root cause analysis enhances patient safety by driving evidence based reforms through ongoing evolution, which is needed for optimal results. Although there have been some negativity in some research, like Velesky's 2018 report, that in mental health it lacks attention to patient factors in adverse events, which could be a negative factor in that when the patient is not there to, sometimes in terms of suicide, if the patient is not there to give evidence, that can be a major negative event in root cause analysis. In wrapping up, root cause analysis is a powerful way to keep patients safe, and it helps us to meet compliance requirements. But its real value comes when you use it to drive lasting change, to ensure patient safety, not just to tick a box. Thank you for listening. I have just included a reference list in the next slides for transparency. Thank you.